So the chlamydia that we're talking about, not koala chlamydia, is chlamydia trachomatis. And it's an interesting bacteria because it can't really live on its own. So it actually lives within your cells. And so you can imagine if you were bacteria living in someone else's cells, you don't really want to cause too much mayhem because you don't want the body to know that it's there and to kick you out because you're dependent on that. So it's almost like a little bit of a parasite. It gets into often the lining of the genital tract, and it just kind of reproduces in your cells there. And that's how it kind of continues its lifespan. And because it does tend to do that quietly, it's often a silent infection. So people may not have any symptoms, but the concern is long term, it can cause inflammation. And I'm sure as a recurrent theme on this podcast, inflammation always leads to badness the longer it's been going on. So within that area, we think about things like pelvic inflammatory disease or PID that can lead with complications like developing an abscess or big infections. You can develop problems with infertility. It can cause complications in pregnancy. And similar with the koalas at birth, because again, chlamydia can be passed on, you could also cause blindness as well in infants. So it's often actually something when a new baby comes out, we put this little antibiotic gel and goop on their eyes, and it's specifically to treat against chlamydia or gonorrhea just in case. And then for gonorrhea, it's another bacteria. This bacteria is called Neisseria gonorrhea, which is kind of the cousin of the big bad bacteria that causes meningitis, which is again a kind of swelling of the brain that you can see. And so unlike chlamydia, gonorrhea announces its presence. It doesn't hide in the cells. It's not dependent on being inside of our cells in order to grow and reproduce. It kind of attaches to, again, the genital tract with little hair-like things, and that triggers that inflammation. And so it tends to be more symptomatic where people have redness, they have burning, they have discharge, like all those things that make people quite aware, and they usually seek treatment. Again, there are some people that can be more asymptomatic or not have symptoms with gonorrhea, but as a whole, it usually announces its presence, if you will. So if you think of chlamydia as like the ninja of the two, and gonorrhea is kind of like the super loud frat kid who's like, or like the Kool-Aid Man, you know, like I'm here.
Oh yeah,
guys. I don't know if we're doing fan fiction yet, but we got a whole comic right here. Yeah.